Good morning, everyone. Welcome to today's episode, or what are we on, the fourth day of the SOFT virtual conference. And we've got some great things coming to you today. We apologize for the delay this morning. We just had a little bit of a technical delay. Those things happen, and we've done really well so far. So to give us some grace, that would be wonderful. Anyway, we are excited to be here today. We've got a great talk. I know you're really going to enjoy it. Before we get to that, just know we have more today. We have our candle lighting ceremony this evening. We have part of our professional panel this afternoon, and just still a lot more to come in this virtual conference. So we are excited. And our speaker today is someone, he is SOFT history. Let's just put it that way. Past president of SOFT. Dr. Cantrell, he's an optometrist from St. Louis, a member of the SOFT Medical Advisory Board. He received his training from the University of Illinois College of Optometry in Chicago. He and his wife, Peggy, have two children, Ryan, a trisomy 18 angel, and Lauren. Dr. Cantrell's son, Ryan, suffered from frequent seizures and was painfully light sensitive. Recent studies have shown that children born with trisomy 13 and trisomy 18 often are diagnosed with photosensitive epilepsy. PSD seizures are caused by various patterns of light, including common technology while playing with mom and dad. Dr. Cantrell's workshop, Photosensitivity, Seizures, and Headaches, will review the many triggers causing seizures and how to protect your child. Nutrition, eye protection, and removing triggers around the house will decrease seizure activity. Dr. Cantrell successfully treats adults with photosensitive seizures and often are eliminated completely. Photosensitive epilepsy causes the same problems in adults as it does in our trisomy children. This workshop will be interactive and we will have time for questions. And so, as you know, as an attendee, you are hidden, you're muted right now. You'll have time for questions at the end. You'll either be able to raise your hand or put them in the chat. But right now, let's go out to our friend, Steve Cantrell. Dr. Cantrell, over to you.
Thank you, Terry. Thank you, Kelly. I'm just amazed with the technology we have and what we can do. It's amazing. Well, good to see everybody. Good to chat with everybody. Give me just a moment. I lost my screen. And I'll have it back shortly. Hang with me just a minute.
And while you're getting that done, just so everybody knows, just bear with us a little bit because we are running the PowerPoint on someone else's computer. So he's having to communicate to keep things going. So just bear with us today. Appreciate it. Thank you.
So I think we're all set. And Kelly, go ahead and advance to the next slide. And again, Terry, thank you for that kind introduction. The SOFT has been a leader in a lot of our thoughts and research on our children. And of course, I had to have a shameless plug for our family connection. This is our son, Ryan. He was born with trisomy 18. And as Terry mentioned, he was the first evidence and observation of painful light sensitivity and seizure activity. And our first conference, the kids in the park were doubled over in pain from being outdoors in the light. And so we've been looking at this for a long time. And it took a while for the light bulb to go off and figure out what was going on. So Kelly, let's go ahead to the next slide, please. And so just click in each, so we need to advance the various titles.
Okay.
So go ahead and click it again. And the summary of our presentation basically is the disclosures as a parent and as a member of SOFT for many, many years and observing the kids. The goal of this presentation is to create a comfortable home environment. If we could reduce some of the seizure activity, make life more comfortable, everybody's going to be happier. It'll feel more like a family without having to worry about triggering a seizure. We're going to discuss photosensitive epilepsy, both trisomy 13 and 18. I've been working with young girls primarily, ages 6 to 9, with sunflower syndrome, very rare disorder. We know about very rare disorders, but they suffer a particular type of seizure that may apply to our kids. So as you listen to the presentation, no, our children don't have everything. So, and some of this may apply, some of it may not. So all of our kids are uniquely different, have family patterns, but don't necessarily have photosensitive epilepsy, but it would be more likely than not that the seizures have this as a potential trigger. There are other triggers for seizures too, but we're just specifically talking about photosensitive triggers right now. So Kelly, please advance to the next, there'll be another title. So we're gonna be talking about symptoms, go ahead. The triggers, go ahead, Kelly. And continue on, where are the triggers? How do I protect my child? And go ahead, one more, is nutrition and lid hygiene. So we're looking at the epilepsy, but we're also looking at nutrition, which is so vital. We've had many families juicing specific things that have eliminated light sensitivity. And Chris Donahue was the first to discover this with her daughter Mary. And then lid hygiene, because possibly our trisomy 18 kids, more than 13, long eyelashes, goopy eyes, a lot of irritants. We're going to be able to clean that up with over-the-counter products. So Kelly, please advance to the next slide. And so you go ahead and fill the screen up, that's fine. We can stop there for just a moment. So seizures occur, photosensitive seizures occur to visual stimulation, exposure to certain light. And it can be an absence to a full-blown, more severe seizure. Warning signs, you already know probably when your child is going to have a seizure. They're just little odd sensations, a shudder, a tick, or it just happens. Interesting with sunflower syndrome, again, which we're not saying that sunflower is related to trisomy, but there's themes and variations in the seizure community. So the kids with sunflower will wave their hand in front of their eye, and that's a seizure occurring. And we'll get into that more in a little bit. And Kelly, go ahead and advance one more. Let's see where we are. And let's go to the next slide. So we'll start with sunflower because this has been fascinating. We have a contact lens that I'll show a picture of later that has eliminated the seizures in photosensitive epilepsy. And if it's a true photoepilepsy diagnosis, these contacts work like crazy. Sunflower syndrome is a theme and variation. We blended the filter to filter different lights. There's specific wavelengths of light that trigger these seizures. And the sunflower contact lens has just been used 2 weeks ago with success. So a little girl plays a lot of softball. And so with sunflower, they might have 400 to 600 episodes every day. So that's really annoying. So they continue to function, the kids continue to do what they're doing, but then you see the hand waving in front of the eyes, and it's similar to a strobe effect. So they're actually between their fingers and the sun. So sunflower diagnosis is sunflowers turn towards the sun. Children with sunflower syndrome they can't help themselves but turn towards the sun, and then bam, that's the trigger. And then the hand waving, we think, is like a strobe effect. So it's sunlight through trees, flashing lights, things like that. So there's some self-stimulation that's involuntary. They don't know they're doing it. Kelly, let's go ahead and advance. And anyway, continue on. And let's go ahead. We'll go to the next slide. So this is what kind of gave us the breakthrough. So I believe it was 2015, the Journal of the Japanese Society of Child Neurology presented a paper that they had diagnosed children with trisomy 13, and an EEG study, which is primarily the way it's diagnosed, with photosensitive epilepsy. So they just call it epileptic spasms. And Kelly, go ahead and advance to the next slide. So that was an important breakthrough. That really connected dots. So with seizures, we all know that it can trigger apnea. And so there is a connection when our children have a seizure to the potential for apnea. So if we can eliminate the seizure or reduce the seizure, those apnea events that are directly connected would be reduced. Kelly, let's go ahead, please. So this, we'll just hit this very briefly, but a seizure by itself does not mean epilepsy. But with our children, I think the diagnosis of photosensitive epilepsy applies, so that connects the dots, so it can be called epilepsy. Kelly, let's go ahead and proceed. So the triggers for photosensitive events with our patients in the office that report problems. Strobe lights, emergency vehicle flashing lights, our new LED headlights are awful. Retail stores, the banks of LED bulbs and fluorescent tubes, because there's always a fluorescent tube going out, so there's a flicker rate in there. Our kids are very sensitive to the flicker. Cell phones, anything with an LED backlight, which is every screen, including our TV, reduce the illumination, so you can go into the brightness setting. Just one click, you won't even notice it, but it's reducing the emission. On most of our technology, we have a night shift or a blue light blocking setting. Turn that on. And the reason this is important is that we want our children to hang out with us while we're watching TV, while we're on our computers, while we're doing everything. But those are triggers. Kelly, let's go ahead. And Kelly, if you can click it one more time. Okay, a little bit of humor here. Thank you. The main thing is the triggers are in modern, our new normal, which has nothing to do with COVID. It's our new normal with all our screens. Everything has a flicker, has a problem, has things going on. And when you have the opportunity, switch back to the old incandescent bulbs. They're back, and they don't have the toxic light that an LED has. If you need to stick with LEDs, warm them up. Put a color in there. That's very necessary. And so Kelly, let's go ahead and advance. So the main thing is that there's no safe space for our kids. So our kids need to be wearing sunglasses, indoor protection. So the dark lens, we will show in a minute, needs to be on all the time. So when our kids are awake, eye protection. Kelly, let's go ahead. We'll move on from here. So pediatric sunglasses, a good quality optician or a private practice optometrist manages frames and lenses. So our ophthalmologists absolutely have a place in the treatment and care, but the eyeglass, their opticians that are with them won't always have access to the pediatric things. And then so hats, tinted windows, we'll look at different lens options in a little bit. The Blue Tech lens I'll show you is the one that's readily available, and that would be the sunglass version. So our kids are going to look cool. We need to have them wearing the sunglasses indoors if there's seizure activity. There's an indoor version and an outdoor version. The indoor version is more likely to stop the seizures because it's a little more filtering. Nutrition, we'll discuss. Lutein and zeaxanthin are the only antioxidants in the eye. There, you can Google a list of vegetables that are rich in lutein and zeaxanthin, and you can juice those. That's what Chris Donahue did for Mary. And so we can resupply the macula. That's ground zero for our kids. All the light focuses to the macula. Lutein and zeaxanthin intercept that, and it doesn't store up. So we have to keep it going, keep it in our diet. The tinted prescription glasses, if there is a prescription, get the outdoor blue tack darker. Let's go ahead and advance to the next slide. So the blue tack has a pigment infused layer. So the high energy blue light, there's on that graph there. And so think of a rainbow, appropriate for soft. The ultraviolet end is the blue end, that's invisible. That light that's next to the ultraviolet is really the tough stuff for adults and kids. So anybody that's on a screen for any length of time needs to have protection. So there are blue tech indoor lenses for mom and dad without a prescription. That's the best one. Kelly, let's go ahead and advance. So that's a color. So the right lens is the outdoor, which I prefer having our children wear indoors. That's what our adult patients do. It's in their contact lenses, but it's effective. The indoor version you see has a little tint. So that's available for mom and dad to just wear over contacts. It's available in your prescription, but if you're on screens all day, you gotta have it. It's become an epidemic, and it's really serious. And adults are developing absent seizures from our constant online activity. Kelly, next slide, please. So this is our model, Tyler. He has photosensitive epilepsy. Those are the glasses that are a wrap that has the cobalt blue filter. And again, the blue tech is very effective too. These are harder to come by. You can see the contact lenses, how dark they are. We now been able to develop that into a pupil size only. We custom designed the filter for sunflower, which is different for photosensitive epilepsy, but our patients that have the diagnosis match with this lens, we've been able to reduce the seizures to 0. And we have clean, as of about a month ago, a second clean EEG while wearing the contact with photosensitive epilepsy. In my opinion, that's a big deal. That's a breakthrough. Let's go ahead to the next slide, please. So nutrition for everybody, but our kids especially, this is what Chris Donahue did for Mary. She woke us up on that, and it was effective. So Mary, when she, like other kids, Mary, when she'd go to the car, would be doubled over in pain. When her blood serum levels were elevated from juicing of these nutrients, she wasn't light sensitive. So her aide was mentioning she's not holding her eyes, she's not doubled over, she's up, she's looking around. She didn't have her sunglasses on. So nutrition with lutein and zeaxanthin, and again, that's food group supplements are available with that. Deposit in the eye for adults, prevents cataracts, macular degeneration. Excellent for the cornea. We now know that it's good for cognitive thinking, so it deposits in brain tissue. That's relatively new revelation, so I need an industrial amount of that for cognition. Goes to our skin. When we get a sunburn, it's lutein that reverses the sunburn, heals the tissue. And it's the only antioxidants in the eye. We can juice it, as mentioned. Goji berries, dried goji berries, available everywhere. Don't have much taste, but throw those in salads, juice it for the kids. It's a big deal. They're really nutrient dense, and they're very effective. Next slide, please, Kelly. Here's a goji berry. Big deal. We have them every day. They're available chocolate covered. Kind of defeats the purpose, but makes them good if somebody's having trouble eating them. But you can blend them up, throw them in salads, throw them in oatmeal, whatever you need to do, put them in there. Next slide, please. So this is really an interesting photo. So the macula that you see the schematic of the eye to the right with an arrow to the macula. This is a cross section of the macula, that one dead ahead. That yellow, little faint yellow layer in there, that's actual lutein and zeaxanthin deposited in full amount in the macula. So that's intercepting light before, and it changes the wavelength of light from the high energy blue to one that's less damaging. So the lutein, the actual color is the yellow of corn. Zeaxanthin, it's an orange bell pepper. Blend those two together, that's what we end up with. Kelly, next slide. And hit it again there, and let's see if that will, oh, I'm sorry, okay. So for trisomy 18 and 13, so we're gonna, can you back up one slide, Kelly? See if we can go back one. If not, we're good. Of course, I had a glitch on my computer at the last minute. That's why Kelly's managing this for me. Let's see if that'll, no, let's just stay here. So anyway, Google foods rich in lutein and zeaxanthin. That's readily available. I forgot to ask everybody to grab a pen and paper. We have some other things that I want you to write down here in a minute. And so protective glasses, tinted auto windshields. You might need to get permission from your pediatrician to do that. They'll allow it. The State Patrol wants a note. And the juicing. So trisomy 13 kids oftentimes have a cataract as a possibility. If it's really impairing vision, cataract surgery is available. If you juice those nutrients for our trisomy 13 kids, it does sometimes stabilize the cataract, reverse the oxidation, and that's something that can happen as well. But these are healthy items for both 18 and 13. Kelly, next slide, please. So go ahead and click it again. Now this is just an overview of glaucoma. That's diagnosed at birth. The nutrition will also help reduce eye pressures if it's there. If the kids need drops for glaucoma, that's for adults too. Glaucoma drops eventually just are really irritating. And so you always want to hydrate with an eye drop like Refresh, which is an over-the-counter. Lots of good Refresh over-the-counter drops now. With our kids, you want to hydrate their eyes at least 3 times a day. First thing in the morning, before bedtime, that's the driest time. If we go to bed dry, we wake up dry. And during the middle of the day, it could go in right on top of contacts for all of us. Kelly, let's go to the next slide, please. And let's go on to the next one. So let's talk about blepharitis and dry eye. So our children more than with 18 rather than 13, long eyelashes, goopy eyes, can be stuck shut in the morning, comes and goes. Warm washcloth will clean that off very nicely. There's some over-the-counter products that are wonderful for cleansing and cleaning. I'll have them to show you. We'll write that down. That next to the last is OcuSoft pre-moistened lid scrubs. Write that down. In the blue, you want the blue color. It's available in different colors, but the blue is the one that you don't have to wash off. And OcuSoft has an eye drop called Retain, R-E-T-A-I-N, and I think it has an E. I think these are available online from OcuSoft, but take a look at the OcuSoft webpage. All of their products are going to be there, but those are great. Another one that's absolutely wonderful is Hypochlor, H-Y-P-O-C-H-L-O-R. That's hypochlorous acid. Sounds delightful, doesn't it? We're going to put acid in our eyes. But it's a spray, closed eye spray. then you massage that around, but it's an antibacterial, antiviral, as it turns out. And it's amazing to maintain healthy tear function, and it's become a big deal as far as our dry eye community. So Kelly, next slide, please. So the question is, does my child need glasses? And go ahead and hit that again, Kelly. There's, I think, 3 lines there. So anyway, does your child follow you around the room? That's it. Make eye contact, follow you across the room. If they're only able to see you close up, that might indicate they're nearsighted. So mom and dad's prescription is going to be there, possibly, and we might need a prescription glass. So just looking at things like that. Our son Ryan down in the lower left, he was holding his fist up. He was looking at his hand, and I had him in the lower right-hand corner. We have an activity toy. Mobiles are wonderful. You know, black and white is more contrast. The kids respond to that. So there's so many wonderful tools, and the good news is that I think they're still out there without having to put it on a screen. We don't have to go to the computer for this stuff. So get something that's not on the computer, even stuffed toys that are black and white, visually stimulating. Those are wonderful. You can move those around in front of your child, and if they follow that movement and see how their eye contact is, if you walk in across the room, you can look at them and see if they're following you across the room. Then, you know, we have good vision. And if there is a cataract present, if they're doing all of that, the surgery would be optional. I think if the cataract is really impairing vision and they're not able to function, then it makes sense to do that. And that's a straightforward, non-invasive process that doesn't require, well, for our kids it would require anesthesia, but it's low risk. Kelly, next slide, please. So the special pediatric sunglasses, sometimes they have a wrapped cable that'll go around the corner of the ear. If we have time, we'll see these here in just a minute. Your car window tints, things like that. Anti-reflective, anti-glare coatings are really a good idea for the kids as well as adults. Kelly, next slide, please. So let's go ahead, click that slide again. Let's go ahead and advance on. Of course, you'll see some familiar photos, and these are hits from the past. And you notice the kids are wearing sunglasses outdoors at picnics. And let's go ahead and let's continue on. And we'll continue on there. And let's do one more. And go ahead and click that, I think, yes. So I think we can pass on this one as well. Let's continue on, and we'll talk more about lutein and zeaxanthin. It's just very, very important in everybody's daily function. It's a powerful antioxidant. It does many, many things. So just a quick note here. I do receive the current research literature from Kemin Foods in Des Moines, Iowa. They're one of the major researchers on lutein and zeaxanthin. And there's some anti-cancer aspects of lutein and zeaxanthin that are fairly significant in breast cancer. So that's just an aside, but it's one of the benefits that hasn't really been discussed. Kelly, next slide, please. And go ahead from there. We'll click on from there. Okay. So there's my email address, and feel free to email with any specific questions. Some of the slides that I was hoping to include didn't make the cut, and so there is some additional information that I'd be happy to pass along. And Kelly, can we go to full screen. Would that be okay? So this is the OcuSoft pre-moistened lid scrubs. They come in individual packs. These are wonderful for everybody, and they're pre-moistened, great for our kids. They're very non-invasive, but they clean like crazy, and they have a restorative benefit as far as tear function. You can't overdose on them. But the blue box, that's what we want in this pre-moistened lid scrubs. The Refresh, there's a Refresh, let me turn this light on here. So this is the Refresh Relieva drop that is available over the counter. That's the same thing. There's a Refresh gel. So this is a Refresh gel. That's great for the kids, great for all of us at bedtime because it stays in the eye, really rehydrates. So the Refresh products, they just came out with these, and they're fantastic. So I wanted to show you, we might be able to see this a little bit, the difference in tint. So this lens is the cobalt blue. The one over here is the Blue Tack. They both have their place, but the Blue Tack is readily available. That's the lens that I would prefer for our kids, and to wear it all the time. So there are baby bands, frames with an elastic strap. There are for older kids. There are pediatric frames. These are good. For the younger kids, we want a cable wrap temple. And one of our friends of Soft has developed this style of frame. He was in Ann Arbor, and I apologize, I can't remember his name, but I know we have it. But he's developed some specialty frames that are adaptable for, these don't have to are not supported by the ear. Cable temples are best to keep things up. And then there are different bridges, nose pads for the kids. This is let's see here. So this is an example of a Blue Tack outdoor. So it will transmit light through it. You can see it's letting a little light through, but it's the most powerful high energy blue light filter that I've found, and it's the one that I would recommend. So I think with that, Kelly, if we have any questions, and Terry.
We do have several questions in the chat.
All right.
So let me start with the first one from Rhonda. It says, my daughter seems to have sunflower syndrome as you have described. However, she also shudders that seem to occur more often in the evenings, but also occur when she is cold, surprised, or scared. Do you think this might be a seizure as well?
I think so. Now, again, the hand waving is one of the characteristic things. I know some of our kids do that. I hadn't connected the dots until we attended conference and some of the clinics, and so it makes sense. Please email me and let's talk about that. But I think the answer to that, with this new information on the sunflower kids, is possibly yes. So a seizure is not, there's not just one way it happens, one trigger. There are specifics in photosensitive epilepsy and sunflower and trisomy 18, trisomy 13. So very possibly. So again, eye protection, nutrition, that will hit it from all directions, and wear the eye protection all the time. If we do that consistently, and the nutrition intervention, there'll come a time when you'll be able to tell we don't need it as much. One of our photosensitive epilepsy patients in Wichita, 16-year-old, he's driving. He can now drive because he has no seizures, but he's sensing he can begin reducing the tint. So he doesn't need the full protection. So there's been some improvement somewhere. And so that would be my answer to that. But drop me an email. Let's chat about that.
We have a question from Aaron Heddick. It says, has nutrition shown effective for kiddos who don't have light sensitivity seizures, but other kinds of seizures?
Oh, yes. Yeah. So, the photosensitivity, but now I can't equate it to other kinds of seizures, but it goes to the cellular level. It goes into the brain. So they're the only antioxidants in the eye. And now that we know that this antioxidant is also participating in the brain, cognitive thinking, the recent studies, cognition improves for anyone with a rich supply of lutein and zeaxanthin. Cannot hurt, can only help.
Okay, I have a question
So that
from Nadine Kohark. It says, thank you so much for your presentation. I was wondering what type of glass material is the best when blue tech is not available, like here in Argentina.
Polycarbonate is available, and poly is a fairly heavy UV filter. If you can't get a blue tech, just have them do a gray 4 solid tint. So gray 3 is a standard sunglass tint. So just have them make the sunglasses dark as they could make it. Now let me a caveat on that. Let me back up. Polycarbonate doesn't dye as dark as a plastic lens does. So the plastic material, so if we want to get as dark as we can get, do the plastic. If they can do a polarized gray in plastic, that would work. So, we can do a polarized gray in poly too. Polarized gray would work. That should be readily available in many different materials. The poly is more break-proof, and they may be able to add an anti-reflective, anti-glare coat as a possibility. So we're looking for things that we can get.
We have a question from Beth. It says, what age do the seizures start? Are they always light related?
Our kids, so I'm not sure about that. I don't have that answer. That would be good for Dr. Carey. But I think it's early onset because our trisomy 18 children for sure, and I think 13 as well, are deficient in macular pigment. The macular pigment is lutein and zeaxanthin. Lutein and zeaxanthin, we've shown with juicing, can restore that. So that's one thing that our kids are deficient in that can be restored with juicing and proper nutrition. So, so early on from birth, it's been my observation, and not everybody, but it's been my observation that kids are painfully light sensitive. And that can be then the leading trigger for photosensitive seizure. So I think I'd be suspicious from the beginning. Now, if they don't have seizures now, do all of those other things, and that can be preventative maintenance that will keep it from happening.
We have a question. Do you know if there are any kind of lutein diet supplements apart from food per se? I've read that goji berries are contraindicated to patients who take blood thinners, diabetes medications, or blood pressure medications.
Oh, for Pete's sake. Well, I didn't know that. So I've learned something. Yes. So, Preservision is a supplement that I think is readily available. You can, I think sometimes they're capsules. You can pull that capsule apart if you're juicing or a G tube, put the dosage in. You can't overdose on it. It is water soluble, so it'll filter out. So that is a way that you wouldn't have to worry about. That should take care of lutein and zeaxanthin. And then, so when you're breaking that capsule apart and putting it in their food, it needs to be with food, taken with or before a meal. Mom and dad, take one of them yourself. Very beneficial, has so many benefits. So you can do it as a family.
Aaron asks, have any trisomy children grown into photosensitivity seizures? Past EEGs have shown none, but could it arise?
Now, this is the mystery. So Zion Lent taught me a lot. So when I saw the study, the Japanese study that said trisomy 13 kids have photosensitive epilepsy, I was shocked, because whenever our kids are together, our trisomy 18 kids always are more light sensitive than trisomy 13. So Jamie and I had a nice chat, and he said every time there's lightning or even thunderclap, Zion would react. So if it was just lightning without the thunder, Zion would react. Now Zion had microphthalmia, which is an underdeveloped eye. So I wasn't sure how much function we had, but there was a lot. So that taught me a lesson. And the Japanese study says yes, but it doesn't mean you're going to have a seizure. So it may be, if we do the nutrition, the vision protection, we're doing everything we can to prevent those seizures. So the seizure may be occurring in more of a sunflower, where it may not be hand waving, but it may be just a reaction to it, just a shudder, a tick, something like that. And the sunflower kids are known as sunflowers in their community, which I think is interesting, is fun. But they have so many of these all day long, but are able to continue to function. So if they're walking along and have one of these, they'll keep walking and then they'll wake up. So it's a brief absence. And you're now my research assistant, and let's do some things, continue to observe. Please let me know. Send me an email. We'll chat about that on email.
Jennifer
Okay,
Hansen.
next.
Jennifer Hansen asks, can medication-controlled seizures, no breakthroughs, and light sensitivity, closing eyes in bright light, but no evidence of pain and no seizures, exist independently in a child? This seems to be the case with their daughter.
Yeah. So no seizures, is that right?
Their seizures are controlled by medications. There's no breakthroughs.
Oh, sure. Yeah. Okay. So that's great. Now, if you administer the sunglasses and the nutrition, that will reduce some of the triggers, and then you can discuss that with your pediatrician or neurologist. If you see the seizure activity drop, you may be able to reduce some of the meds. So if we employ the strategies that we know eliminate seizures, our patients have been able to go off meds with the advice of their neurologist. So that would certainly be worth doing. But again, just use your best judgment on what's best for your child. But the other things are good preventative maintenance.
Okay, I have a question from Carice. It says, can sunflower syndrome be detected during an eye exam?
I don't think, well, it's really symptoms. So with photosensitive epilepsy and sunflower, my diagnosis is made with a conversation with parents and symptoms, and then observing the child while in the chair. So the eye exam itself, if I didn't know, and I was examining a child with sunflower. Now, here's what might happen. So this is a good warning when you have your eyes examined. I learned this the hard way in Salt Lake at the Soft Clinic. An ophthalmoscopy, the lights that are used during an eye exam to look in the eye, can trigger a seizure. So when we're checking for prescription, we're waving lights back and forth, And when we're looking in the eye, we have a halogen beam a lot of the time that's really intense. And so I discovered that the hard way because I just triggered a seizure in one of the kids in the clinic. So that was good information. Sorry I did it, but it was great information. So when you're having your eyes examined, mention to the doctor, photosensitive epilepsy may be present, sunflower may be present. It's just that will allow the doctor to do a quick exam without, and turning, they can turn the intensity of the light down a little bit and still get some details. There are wonderful new cameras, OCTs, that don't require dilation. Possibly, it would be a little more difficult to do that with a child, but we've got some very advanced technology that can see more in the eye without the older-fashioned ophthalmoscope. So, so it's interesting. It sounds to me like some of our folks on with us today feel like there's a connection with sunflower and connecting that dot. That's amazing. That's fascinating information because I just figured this out 2 weeks ago, and I think there's a connection with our kids. So I'd love to hear about it. Email me if you notice that. That's an important topic.
We have another, Madai says, thank you for all the info. Can sleep apnea trigger seizures?
Sleep apnea may have been triggered by a seizure. So the chicken and the egg. So the Japanese study was talking about the apnea triggered by seizure, needing more study to figure out if the apnea was triggered or what triggered the apnea. So we know that a seizure can trigger apnea. Other things can trigger apnea too. But there potentially could be a trigger with that. So the interesting thing about, let's just say photosensitive epilepsy. So our patients that we work with are adult patients. They can feel like they've been exposed. They were exposed to things that might have triggered a seizure, but didn't. And so later that night in their safe space, they have a seizure where they don't have a seizure. So it's an additive effect. It kind of fills our bucket and then it overflows and then we have a seizure. So as an aside, I don't know that I mentioned this, but a screen in front of a screen is really toxic. So you don't want to hold your cell phone up against your computer screen because that's 10 times the amount of high energy light for you, but that's also 10 times the amount of light if your child is in eye contact. So separate those things out. And there's a download, paper and pencil now, there's a download called Flux. I almost lost it. FLUX. That is a free download to, I think, Apple and PC for sure, that you can turn on your monitor. That's the blue light filter. Your iPhones have the night shift. So the night shift you can turn on. Definitely if you're around your kids, flip that on because that eliminates that high energy blue light that is so intense and builds up. So remember, these things are all additive. And if we can keep some of them away and keep our buckets less full, then the potential for a seizure popping up is less likely.
Okay, we have Jennifer Hansen. Would seizures triggered by light sensitivity be caught on an EEG when they flash the bright light during it?
Well, the EEG would definitely cause it. So yeah, so if you have an EEG, that's attempting to provoke a seizure. So they're trying to cause a seizure. So if an EEG provokes a seizure, then it's caught. They will know. And then there are certain EEG patterns that are characteristic of photosensitive epilepsy and sunflower. So that's a good diagnostic tool to determine if that's there. Now, we've done this a couple of times, but our kids can wear contacts. Now that means you have to put them in, you have to take them out. But our kids can wear contacts. So that's an option if we ever want to do that, that you put them in the morning, take them out at night, but they're fully protected all day long. They can't look at anything without being protected. Now that's a little far out, as John Denver would say, but absolutely. So we're learning more with our sunflower kids, with our photosensitive epilepsy kids and adults. So they're telling us, what happens. And so my hypothesis here is photosensitivity, photosensitive epilepsy is photosensitive epilepsy. So if it's photosensitive epilepsy in our adult population, it is photosensitive epilepsy in our kids, with all the perks and benefits that go along with it and all the protection and prevention. So I'm just making that leap and that connection that there's similarities that are occurring. And it sounds like we've got similarities in sunflower too, which is very exciting to me. Okay, Kelly, next, please.
We have from Lizzie asking, are there the sunglasses for grown-ups?
Sure. Yes. So Lizzie, if this is who I think it is, yes. So the Blue Tech outdoor tent is available in New York City. And so you will want the sunglass version, but you can also have the indoor version. So when you're on a computer, Blue Tech Indoor for you, Lizzie, probably will be very protective when you're on your screens. And the Blue Tech sunglass when you're out styling in the hood. So it's very helpful, and I definitely recommend it for you.
Okay, we have another question from Carice saying, can a child have sunflower syndrome but no seizure activity?
Yes. Now so I'm still learning about this, but from the families that I've spoken with, when you see the hand gesture, it is the seizure. Now, they don't have a debilitating occurrence such, oftentimes there's not an absence and there's not a more severe seizure. So they're little mild seizures, but they're categorized as seizure. So if the hand goes up in front of the eyes, that's the seizure. So that doesn't cause the seizure, that's the seizure. And that was enlightening to me. I didn't know that. So when you see that, that's it. And so it'd be interesting to me if our families in SOFT have the hand gesture with some of the kids. That would be fascinating to know.
Madai says, can seizures develop at any age or as our kids grow?
I probably, it can, it's possible. So, but if you're fully protected, following the nutrition, wearing the protective lenses, cleansing, cleaning, hygiene around the eyes, that's all really important. The hydration of the eyes, the tear film, keeping that bacteria level down with that type of cleansing is really important because that can be an irritant, and some have mentioned that's a trigger too. So it certainly makes everybody feel better and feel more comfortable, adults too. So mom and dad, you can do the same type of hygiene that the kids are doing. It'll feel great.
And then Jennifer Hansen asks, are there specific medical or anatomical reasons why our kiddos with trisomy 18 are so sensitive to light? My daughter's ophthalmologist always attributes it to her light-colored eyes, but I know it's definitely more than just that.
Well, and that's so, yeah. So the answer to that is yes. And so pigment's a color, and we're going to go back to there's going to be a 10-point quiz on all of this later, so everybody get ready. So the pigment, the corn, the yellow in corn is lutein. The orange in an orange and orange yellow bell pepper, that's zeaxanthin. So they're brightly yellow, brightly orange colored. So pumpkin, sweet potatoes, the leafy greens, kale, collard greens, and spinach. The yellow is under there. The green just covers it up. So kale is at the top of the heap. Spinach is more palatable. So an MPOD, M-P-O-D, is macular pigment optical density. We can measure that now. So our children, the macula should have a certain amount of pigment or pigment density that filters light coming to the macula. So imagine the macula as a cup. Fills up with lutein and zeaxanthin and intercepts toxic light as it comes in. So we know that our kids are low on macular pigment. Now that's ground zero. The macula is where it all happens. And so if we can build that back up, and we can with nutrition, that's going to prevent. Lighter colored eyes are more predisposed because the iris, the blue iris lets more in. A brown iris filters more out. That's true of adults as well. Lighter colored hair. So the pigment shows throughout in hair color, iris color. So that's right. But what our kids have taught us, and what Chris Donahue taught us, is that you can resupply the macula with the proper amount of pigment through juicing. But just keep in mind, it doesn't store up, so you have to keep doing it. It's on an ongoing basis. So the macular pigment optical density, or the MPOD, if you want to impress your ophthalmologist, is what we need to improve. And so that's where the nutritional supplement can be broken into feeding, and we can be creative. So get that list of veggies and be creative about how you get it in, and how you and parents and family get it in as well. So that's important. These are technical questions.
I know, they're really testing you today, Dr. Cantrell.
They are.
Another question we have is, was there a slide on which vegetables and fruits are best for juicing?
There was, and sadly I had technical difficulties, so I forwarded the wrong one to it. If you email me, what I can do is attach that information. I'll be glad to send it back to you. So you give me a little time, and I'm happy to do that. But you can also Google what foods are rich in lutein and zeaxanthin. So off the top of my head, kale, collard greens, spinach, corn, Brussels sprouts, green peas, the yellow, the sweet bell peppers, the yellow-orange, the sweet potatoes, pumpkin, persimmons. You know, that just made the list. I got to find out from Bobby Flay how we integrate persimmons into the diet. But those are the ones that are the more at the top of the list. So it's not a long list, but they're the more common ones. Green beans, I know, is there in certain amounts. Eggs, egg yolks, it's the yolk. Think of the yellow, it's the egg yolk. There are eggs at the store that have lutein listed on them as being infused. But those are the foods that have shown they work. And next time if you Facebook Chris Donahue, tell her thank you for teaching us how to reduce light sensitivity and what we need to do about it, because she's the one that really taught us that. And she also mentioned a popcorn called Pirate Booty. Now, Pirate Booty is spinach. So that Pirate Booty spinach-based popcorn is also a source of lutein. So if you guys are at home, if the family's snacking, go grab the Pirate Booty and keep that in the diet.
Excellent. That is all of the questions that we have listed right now. Let me check and see if anyone has their hand raised. No, I don't see anyone with their hand raised. So I think we've gotten to all of the questions.
Great. Well, it has been my pleasure. Thank you very much. I learn as much from soft. So this is a pass it forward. Dr. Carey was there. Chris were there when our family needed them. They actually picked up the phone. We were using landlines at that time. And so I feel like, you know, I want to pass anything forward that I can, because those guys are still rock stars today, of course. And it's my pleasure, and it's been fun. So our adult community out there that are not affected by trisomy 18 and 13 are benefiting from the knowledge that we learn from our kids. So there's a lot of research and a lot of good stuff going on that we're able to pass along. And I have begun presenting workshops to the optometric community about this. And it's interesting because everybody has patients. You just don't know what you're looking at. And so the next time you go to your ophthalmologist and your neurologist, mention MPOD and tell them to be careful with their ophthalmoscopes and the lights they shine in our kids' eyes. And they'll look at you and they'll say, well, how do you know that? And we can show off a little bit. Well, I think, you know, one of the last things I can add is you cannot overdose on your rehydrating eye drops. We're all on screens. When we look at our screens, we stop blinking, and that produces moisture. Our blink rate goes really low on screens, and our eyes are so dry. Add moisture. Hydrate, hydrate, hydrate. If you have Pedialyte for your kids, drink it yourself. 6 ounces will give you will prevent dehydration in adults as well. So it's a big deal.
Good reminders.
Hearing something.
Good reminders. And with that, Dr. Cantrell, we sure appreciate your time today and everybody coming today. You know, you basically described Christina's ritual as far as drops and nighttime ointment and all of
Right.
that. And I did get creative, and we're using Ocubite with zeaxanthin and lutein in it. And, you know, it has made an absolute difference in her sensitivity. It truly has.
Oh, it's a big deal.
So it's absolutely a good thing. So anyway, appreciate your time. Always appreciate, you know, the things you bring to the table when you present so many things that just get us thinking with our kids and watching and all of that. So we appreciate that. We are going to wrap up now, and we will invite everyone. Well, we have, we're coming back at 2 o'clock for our professionals panel, where we'll be hearing from Doctors Weaver and Burge. And then tonight at 6 o'clock Central Time, we will be there for our remembrance angel candlelighting ceremony that happens at 6 o'clock Central Time tonight. So we'll look forward to seeing everybody then. Appreciate everybody's time. Take care and bye-bye for now.